Hi everyone, I'm Sean Duhamel from Mass Retirees. Welcome to our weekly video update. Today is Friday, November 22nd, almost the end of the month, less than a week left until Thanksgiving. Today I'm going to focus mostly on healthcare, but what's happening at the state level with the GIC, what's happening with Medicare and the Part B premiums were just announced last week. But before I do that, let me provide a couple of quick updates for you. First and foremost, the election for your elected member to the state retirement system. Now, if you're a state retiree, this applies to you. In order to be a state retiree, that means you had to have worked for and retired from the Commonwealth itself. So in other words, you were a state employee. I'm not talking about retired teachers. I'm not talking about retired municipal workers or MWRA or that sort of thing. You had to have worked for the state. And there are 104 different retirement systems across Massachusetts that all of you come from. So I know it gets a little bit confusing. But state retirees, your election is underway right now for your representative on the board. Frank Valeri, who is our association president for Mass Retirees, he's up for re-election. Frank has served for the last 3 years as your representative on the board. He's one of the leading experts in Massachusetts when it comes to retirement law, retirement policy, and he's somebody who's always going to have your back. That's why it's so important for us to make sure that there's always a representative of Mass Retirees on the state retirement board, and it's absolutely critical for us. So if you haven't already voted, please do so. If you're a state retiree, you have to be a state retiree for this to apply to you. But you got to get your ballots back. They're due by December 6th, which is 2 weeks from today. So don't miss out. Please vote for Frank Valeri. And the next thing I want to update you on is today, as you're watching this, probably, our Southeastern Massachusetts meeting down at White's of Westport is underway. It begins at 11 a.m. this morning, and it goes until about 12:30, quarter of 1. You'll be out of there after the Q&A at 1 o'clock at the absolute latest. But I will be in Westport. Frank Valeri will be in Westport. Bill Reary will be in Westport. And we have these area meetings, as you know, all across Massachusetts every year. We have about 16 different locations across the state. After today, we have just one left for 2019, and that is our annual Central Mass meeting, which is going to take place in Auburn at the Auburn Elks 2 weeks from today, which again is December 6th. So these are your last two opportunities to come and see us and meet with us this year. So if you're in the area, come on by. It's free for all of our members, and feel free to bring a guest. But the big news today is a couple of things. One, Medicare Part B premiums have been announced for 2020. Now, right now in 2019, the premium this is the normal Medicare, the standard Medicare premium, I should say. There are 5 different levels of Medicare Part B premiums, and they're based on your income or your household income if you're filing your federal tax returns jointly with your spouse. The standard Medicare premium right now is $135.50 per month per person. Starting in January of 2020, that Medicare Part B premium is increasing by $9.10 per month. The new standard Medicare premium will be $144.60. Now, according to the federal government and Medicare, the biggest driving force behind this $9 increase is the cost of prescription drugs. Now, not the prescription drugs that you get filled at the pharmacy, but the prescription drugs that are being administered in the doctor's office or in a hospital. So if you go in for some kind of a shot, or if you're hospitalized and you're taking medication while you're in the hospital, the costs of those medications are really skyrocketing. And that is the biggest driving force behind why this is increasing. Now, as I mentioned a moment ago, there are 5 different levels of Medicare Part B premium, and they're based on income. The standard premium, if you're an individual making less, either $87,000 or less per year, you pay the standard premium. A married couple filing jointly, if your taxable income is $174,000 or less, you pay the standard premium. Then there are 4 higher levels of premium based on income. In other words, the more you make, the more you're going to pay. That's the way that Medicare has operated since the early 2000s, when President George W. Bush and the Republican Congress changed the law and put in higher levels of Medicare premiums based on people's income. So that's the federal law that's been long-standing. We will have a full report in our upcoming January edition of The Voice, which is going to spell all this out. Now, the other thing to remember for Medicare particularly, if you're eligible for Medicare, state law says that you have to enroll in it in order to stay on either the state or a local health insurance plan. This has been state law since the early 1990s, and it's been state law at the municipal level since, I believe, 2009 is when that went into effect, so about 10 years now. And I'm just putting this out there as a reminder to our members that it's something you need to pay attention to. Now, the good news is that today, the Group Insurance Commission, or I should say yesterday, the Group Insurance Commission held its November meeting, and some good news was presented. Now, right now, they're working on what the benefits are going to look like for the next fiscal year, which will be fiscal year 21, that begins on July 1st of 2020. Today, the GIC announced that they're working on a couple of things that are very critical to our association, and they're items that we've been working on for a while. The first item is increasing the basic life insurance benefit from the current $5,000 level up to $10,000. The GIC is in the process of hiring a consultant that they can work with that will go out and help them put together a bid for private vendors to bid on this increased benefit, so we can get a clear view of exactly how much it's going to cost and then try to get that appropriation from the legislature. So this is a big step forward. Unfortunately, it's nothing that's going to be resolved tomorrow, but it's a work in progress. And we are working closely with the legislature, particularly the House Ways and Means Committee now that has this legislation, trying to finally resolve this for our state retirees. It's been a long time coming, and I really get the sense that we're close to being able to resolve it. The second big news that came out today is that the GIC is actively working on a plan that would enroll all of our non-Medicare retirees, so any retirees who are age 65 or older, who are not currently eligible for Medicare. Right now, you are insured under the normal non-Medicare plans with all of the active public employees. Now, these are fantastic insurance plans, but the problem is that they're very expensive, particularly the co-payment, the deductible, your out-of-pocket costs, and it's becoming more and more unaffordable for a bigger part of our membership, and we're hearing from folks all the time. One of the solutions to this, or part of the solution to this, would be to transfer those retirees, and there are about 34,000 retirees who are non-Medicare retirees under the GIC. It's a lot of people. Transferring those folks into the federal Medicare program would reduce premiums, it would certainly reduce out-of-pocket costs, and it would be a win-win for both the state as well as the retirees. Now, there are a lot of moving parts to this. We have a lot of questions that need to be answered, and that's why the GIC is doing its due diligence to make sure that they get it right, to make sure this is feasible. We don't want to just rush into anything, but we need to find ways to get these costs under control, and this could be that way. Now, this proposal or plan has already been implemented by a growing number of municipalities here in Massachusetts, and we've been reporting on that in our newsletter. By last count, we're working with about 12 to 15 local communities that have done just what I explained, and it's been a great success. We have yet to hear from a single retiree with a complaint about being transferred into Medicare. Now, of course, there's always concerns, there's always some animosity anytime you're making changes to health insurance benefits. That goes without saying. So we need to make sure that we get it right, and we will be keeping you up to date on terms of what's going on with this proposal going forward. Now, as I mentioned before, the GIC is also working on what the benefit structure will look like next year. And while we don't have the specifics yet, right now it appears unlikely that we're going to see any dramatic changes next year. Now, nothing's ever a sure bet, and we've always got to be on our toes when it comes to health insurance, especially when it comes to health insurance. But right now, we're not anticipating any big changes with your benefits or with the costs, and hopefully that remains to be true. But with that, let me sign off for this week. We'll be back to you again next week with our weekly update, but thank you for your continued support of our association.